Welcome. I'm Sandra Morris, State Education and Training Manager for Missouri Rural Health Association, Health Trend. With me today is Mary Gordon, Project Director, Missouri Rural Health Association and Health Trend, and Dr. Sherry McDonald, Administrative Consultant 2, Office of Health Outreach, School of Medicine, University of Missouri MU Extension. On behalf of my colleagues, let me take this opportunity to thank the Community Health Workers Association of Missouri for allowing us to present our recently created Mobility Management Certificate Program with the assistance of the Missouri School of Medicine and University Extension. Before the curriculum is presented, I would like to take a few minutes to discuss what is mobility management. The concept and process can be used in other services. However, today we're going to be discussing how mobility management is used to coordinate transportation services. The National Center for Mobility Management, NCMM, states, mobility management is an approach to designing and delivering transportation services that starts and ends with the customer. It begins with a community vision in which the entire transportation network, public transit, private operators, cycling, walking, volunteer drivers, and others working together with customers, planners, and stakeholders to deliver the transportation options that best meet the community needs. Some of the key roles for mobility management professionals are understand and advocate, convene and facilitate, design and plan, launch and sustain, inform and connect. At Missouri Rural Health Association Health Trend, we describe mobility management as getting people to where they need to go. However, we do acknowledge it's not quite that simple. Let's take a look at the elements necessary to design a successful mobility management plan of action in a community. The basics of mobility management. The concept is a fairly new one when compared to the long history of modern transportation, planning, and provision in the U.S. Primarily, the concept of mobility management can be thought of as transportation providers shifting their focus from operating concerns to the concerns and mobility of individual consumers of transportation services. In 2003, a movement began among transportation experts to elevate the quality of the customer's experience to that of primary strategic importance and to subordinate the dozens of activities involved in service design and delivery. This was totally a new approach. A shift toward putting customers' needs and experiences first meant abandoning that silo approach and connecting transportation customers with services that might not be directly under particular providers. Mobility management is an innovative approach for managing and delivering coordinated transportation services to customers. It includes older adults, people with disabilities, and often individuals with lower incomes, but also to younger citizens who have disabilities or conditions rendering them unable to drive, or citizens needing transportation for employment, education, and training. Mobility management tries to better serve individuals and the community. Traditional transit service planning is often around centralized, highly traveled routes of a transit system. Mobility management focuses on diversity of travel options, services, and mode to reach a wide range of customers versus traditional transit systems that are built on regional service coverage. Mobility management uses multiple transportation providers to offer the most efficient service to individuals. Traditional transit services typically use a single operator to deliver all services. Mobility management underscores the importance of service advocacy to improve public transportation management and delivery. A mobility manager acts as a travel agent or service coordinator to seek the most effective means for meeting an individual's transportation needs. Traditional transit agencies generally focus on the direct provision of services only. What is a mobility manager? Serves as a policy coordinator. Will work with other staff and supporters to develop, refine, and implement plans that advance a bold, multi-strategy campaign to implement access to transportation for citizens in the area they serve. Operations service brokers will be responsible to assess members' needs with being knowledgeable about their product and process and guiding them to the service that fits their needs, providing excellent customer service, creating relationships among the members and the community they serve, identifying members' concerns, recommending solutions, and regular follow-up. They may be responsible for processing all documentation and paperwork per the membership's policies. Customer travel navigators will serve as direct point of contact for customers, being responsible for superior quality customer service to ensure that each person who requests a ride is treated with dignity, respect, and patience. Must know your community resources, roads, and conditions. Mobility management is innovative in transportation service and coordination, not doing the usual way because that's the way we always done it before. Local and regional solutions to fit community needs and visions. Assisting people facing transportation challenges, whether youth, people with disabilities, older adults, people with limited incomes, to get where they need and want to go so they can live fulfilling lives in their communities. Systematic gathering of information about providers and other resources to provide referrals to assist individuals in learning about accessing community and regional transportation services. A shared table of transportation providers, planners, and community stakeholders, including volunteer driver programs who collaborate, plan, implement, and maintain a family of transportation services. The above attributes of mobility management can be grouped into two main actions. One, understanding the customer a mobility manager is trying to serve, and two, identifying transportation services in the community. These two actions are not fully encompassing of a mobility manager's job, but they are the two main activities that must be in place for a mobility manager to begin the step-by-step process of finding transportation solutions. In order to accomplish these actions, a mobility manager or those who perform mobility management activities as part of a broader role must have certain skills and attributes. The diversity of the activities previously noted necessitate that mobility management professionals step into several roles depending on who they're working with and what they are seeking to accomplish. Mobility management professionals must be problem solvers, tireless advocates for those who need transportation, a facilitator of group discussion and problem-solving groups, a teacher of content and process, a communicator who connects people, agencies, and systems, a cheerleader who can champion the enterprising spirit of potential solution makers. In short, it is imperative that individuals or groups of mobility management professionals understand the unique challenges and attributes they need to have in order to help their customers connect to transportation solutions. This is true regardless of whether a mobility manager works for a transportation agency, human service organization, or any other entity where arranging transportation solutions is part of their job. Step by step, as briefly described above, there are two main activities that mobility management professionals must perform to connect people with transportation solutions. One, understand the customer or population they are serving. Number 2, have a complete understanding of all the transportation services and providers within the service area their customers live and are traveling to and from. Once a mobility manager has a handle on these 2 main concepts, the step-by-step process by which a mobility manager understands customer needs and builds a database of transportation options in the community or region, they are ready to begin. What follows is a condensed 5-step process that lays out the cycle of mobility management from beginning to end and back again. Understanding your customers. To serve all the different types of customers, a mobility manager, in concert with partners, must first understand the needs of those customers. This step focuses on identifying who the customers are and exploring their transportation needs. There are basically 4 types of potential customers: individual riders and their caregivers, particular groups of individuals. Sample is the general public, rural residents, people with disabilities, those needing medical trips, agencies and transportation providers that serve groups of individuals, the mobility management network itself. As a new mobility manager, it can become overwhelming to work with many different types of customers at once. Partner organizations can help prioritize which customers get top priority. Keep in mind that these priorities will likely change over time. The most straightforward way to learn about an individual rider's needs is through one-on-one or group conversations. Those individual conversations may take place after referral from an agency or a family member, or when an individual makes direct contact. For individuals with emotional, cognitive, or communication disabilities, it is important to bring family members or other caregivers into the conversation to ensure the group forms a complete picture of needs and resources. Needs assessment tools. The needs assessment tool is designed to help guide a mobility management professional through the process of collecting all pertinent information from an individual or group. 6 steps of a needs assessment. Explore current transportation options for the individual. Identify where and when the individual needs to travel. Identify considerations that may impact the individual's mobility. Determine if the individual is eligible for ADA, complimentary, paratransit, or similar services. Identify applicable community transportation options. Assess the individual's ability to pay for transportation. Understanding your community's transportation options. In concert with understanding the customers, it is vital to know all of the existing transportation options available within the community or region. These options can include a wide breadth of services such as bus and van services, shuttles, shared ride services such as carpools, van pools, ferries, volunteer services, ambulance districts, medical vans, bicycle and pedestrian options, locally owned cabs, public transportation, agencies with vans. Example, senior centers, YCMAs, VFWs, faith-based organizations, churches, temples, mosques, local advocacy organizations, Easter Seals, United Way, Salvation Army, Red Cross, Catholic Charities, Lyft or Uber, and voucher programs. Also contact these types of organizations to see if they have gathered such a list of services. State departments of transportation, particularly the office in charge of administering transportation grants, or the agency that oversees human services transportation. A local transportation management association, usually made up of local businesses and transportation professionals. A tourism agency or convention, a visitors bureau, the agency in charge of emergency evacuations, which often maintains a list of registered vehicles that can help in the case of an evacuation. Again, determine if your community has a local chapter of the Easter Seals, United Way, American Red Cross, Salvation Army, or Catholic Charities. The mobility management cycle is completed when mobility managers are able to connect customers' needs to transportation providers. Envision this process as a cycle rather than a static list with a beginning and an end, because it encourages mobility management professionals to continue putting customer needs, experiences, and feedback into the forefront rather than retreating to the previous method of simply analyzing a system's performance in a vacuum. Keep in mind the geographic location, income, culture, health, and disability status, as well as working status in designing the transportation needs and preferences of all riders. A beginning mobility manager must take the time to become acquainted with the community they're working in, the community leaders, agency leaders, health and wellness leaders and partners, community diversity and culture and income, available transportation and geographics, major roadways of the community and surrounding areas. It is imperative mobility managers learn who are the transportation customers, when is the transportation needed, what is the transportation options, how to best get customers to desired locations. Become involved and be known to the community you serve. Communicate, communicate, communicate. The 5-step mobility management cycle begins with a full understanding of customers' transportation needs. Brainstorm a potential solution that matches this understanding with a range of available or possible services. Engages one or more partners in providing the solution in a coordinated manner. Empowers customers to connect to the solution. Ensures customers can provide feedback on the solution so it remains relevant and useful. Mobility managers' tools. Know the job description of a mobility manager. Know your product. Get acquainted with the community you serve. Research your community's demographics. Learn your local medical providers, agencies, businesses, and schools. Meet your local government officials. Create a list of the available transits, public and private. Work to create new transportation resources. Learn the major roads and highways. Getting started. Appoint a transportation committee and define the following. Who is impacted? Primarily elderly, medically and physically challenged, homeless and low income, younger adults with disabilities or conditions rendering them unable to drive, citizens needing transportation to employment, education, and training. What happens? People stay healthier and remain active in their community. When to launch? Set a date to launch transportation. Where does it take place? Start small with a designated area and then expand. Why is transportation needed? To provide access to health, social determinants of health, employment, education, and training. Seek a solution. Recognize the need. Develop a plan. Seek funding. Create a marketing plan. Set an implementation date. HealthTran is one of the several service lines under Missouri Rural Health Association. HealthTran is a member-driven model that helps medical providers, agencies, businesses, schools, etc., get their patients, clients, or students to required destinations. HealthTran uses public, private, non-traditional transportation, as well as sponsors a volunteer drivers program. Our goal is to bring transportation options to rural Missourians who are in need of access to medical appointments, social determinants of health, employment, education, and training. In 2019, HealthTran was the recipient of a grant from the Federal Transit Administration, and one of the requirements was to create a mobility management curriculum course for the state of Missouri plus issue a certificate to those who successfully complete the course. For the past 2 years, HealthTran has been in collaboration with the University of Missouri School of Medicine and MU Extension to achieve this goal. This project has required a great deal of effort, not only from our staff members and faculty members of the University of Missouri MU Extension, but also from staff members of several agencies across the state. The Mobility Management Curriculum course has been completed, is now on the MU Canvas. Registration is open on Missouri Rural Health Association website. There are 8 modules in this course, and at completion, each successful student will be awarded a certificate. Before we move to the next portion of our presentation, as a mobility manager for several years, let me encourage those taking the course to pay particular attention to the first 2 modules. Taking advantage of the information these 2 modules offer will enable students to complete the remaining modules more successfully. We invite you and anyone you may know who can benefit from mobility management to enroll in the course. Enrollment is free. The next portion of our presentation is a review of the Mobility Management Certificate Program by Dr. Sherry McDonald. Dr. McDonald has worked as an educator for over 25 years, teaching and creating curriculum and programs for all age groups. She currently works for the MU Extension and School of Medicine's Office of Health Outreach, Education, and Policy, also known as the Office of Hope. Throughout her career, Sherry has been devoted to teaching and learning about social justice, social responsibility, and community service. She believes that learning should and can be a joyful process and that education is never wasted. On behalf of Missouri Rural Health Association HealthTran, we want to thank Dr. McDonald for her tireless work, support, inspiration, and encouragement during this project. We know we couldn't have done it without her. It is my pleasure and privilege to introduce to you Dr. Sherry McDonald.
Thank you, Sandy. So when you are completely registered for the course and can enroll, I want to show you exactly where you're going to come to. So when you open the course, this is the screen that will first come up. We have designed the homepage so that you immediately, first of all, know you're in the right place, Mobility Management Certificate Program, that you remember to bookmark the site because we didn't think of that at first and students had difficulty getting back into the course. And then we want to make sure that one of the first things we do, and always that the student comes first to who is the instructor, and you will be meeting Mary Gordon here in a few moments. But Mary is our instructor for this course. Navigation and Canvas can be done several ways. What we have encouraged our students, as you can see, is to click here to begin. We go to a simple Start Here page. The video contains much of the same information that you have heard already through this presentation, reminding the student, first of all, we go over with the student the intention of the curriculum. The intent is that this is for adult learners who have family responsibilities and who probably already have a full-time job. And therefore, we were more interested in getting the information out to the learner than we were of proving learning through things like quizzes and assessments. So we do include those things, but they are for the learner's benefit and not for us to keep track. We do encourage our students, the very first thing, to review the syllabus. The course syllabus in Canvas is very nicely organized with a course description and the course outcomes. I do want to really quickly cover for you the outcomes that we have chosen for this course. By the end of the course, students will be able to identify their community's transportation barriers and resources, demonstrate a commitment to advocacy, inclusivity, diversity, and equity in interactions with consumers, transportation providers, and community organizations. Identify local transportation stakeholders and organizations to meet the unique transit needs of a community. Identify state and national agencies that provide funding or other resources for mobility management. Identify programs that provide transportation assistance to those who qualify. But one of the major features of this curriculum is that throughout the lessons, every single module, the students will be developing a national, state, and local mobility management resources toolkit. And the intention of this is that the student would create this through the course, but then use that as a resource throughout their career as a mobility manager to continue building upon that toolkit. So we see this as the beginning of the adventure of mobility management as opposed to the conclusion. So from the course, then the student would navigate to the modules. And we do have 8 modules and also the welcome module. The welcome module also allows you to connect to the exact same page as the Start Here. But there are also, just in case the student has never taken a Canvas course, there are also resources here to be able to navigate Canvas more successfully. We have an optional student resources course that is developed by our Canvas administrators here at the University of Missouri. And we do include a registration or demographic survey that must be completed. One of the features of this course is that the student must complete each page of each module or mark it as done before they can continue on to the next one. Some items, such as completing the registration, the student would actually have to submit that before they can move then to module 1. And as Sandy was saying, the first 2 modules are that basis. So that's where the basic foundation of the course. So you're getting to know your community and you're getting to know your consumers. And that is a bigger and harder thing, I think, than a lot of students assume. But we have also connected with the National Center for Mobility Management in the development of our curriculum. The National Center for Mobility Management has resources and e-modules that are going to be invaluable to all of our students. So we don't just recommend connecting with the National Center for Mobility Management for the course. We want our students to register with them and to continue taking advantage of the free resources and up-to-date information that's available. One of the most foundational things in this first module is to learn the language of transportation. And so the resources, 2 of the resources that the National Center can provide are the commonly used acronyms and a glossary of terms so that the student has a good up-to-date foundation for these. As you can see here, we do have quizzes, but again, those are not graded. Those are simply so that the student knows if they've connected deeply enough with the material. Another feature of our curriculum are these toolkit assignments. And because it is foundational, I would like to go over this first one. The windshield survey seems like a very simple assignment. You're just going to drive through your community. However, in these rural areas, when we really sit and think about what is the community that I'm serving as a mobility manager, that is going to be a larger area than just your simple neighborhood and where you go grocery shopping. You're going to have to consider your community through the eyes of all of your community members, where they live, how far do they have to travel to get to shopping centers, to the pharmacy, to the doctor, and how do they manage to do that? So looking at your community with a different set of eyes with a different set of questions. And all of the materials and the instructions for this survey are we have designed to help you do that. All right, so then the first one, what is mobility management? You're really looking at getting that foundational knowledge and looking at your community through those fresh eyes. The remaining modules, getting to know your community. In this one, your toolkit is going to be focused on the community health needs assessment. So that is a requirement now that all areas, all counties or regions have a community health needs assessment. They're easily accessible. Doing a Google search for your county and community health needs assessment generally is all of the foreknowledge you need in order to be able to find one that's relevant to your community. The information that is contained in these CHNAs is invaluable to the work that you're going to be doing on many levels, even when it's not related to transportation. If you have, for instance, if in your CHNA you identify that you have a higher rate of a particular kind of cancer, but there are no oncology specialists in your area, you're still going to be dealing with an increased need for transportation out of your community. So it does change the way that it does affect the transportation needs of your community members. So then in the remaining modules, what we focus on are getting to know the individuals. How do you interview a person? And one of the things that's interesting about Module 3, where we really pay attention to the mobility services consumer, is that we have you look at people who are experiencing different types of transportation access issues. If you are physically disabled, your transportation needs are going to be different than if you simply don't have a driver's license. So we look at those, we have the students interview 3 to 5 different consumers from different stages or different categories, types. Look at that real quick. So the interviewees must be from at least 3 of these categories: chronically ill, someone who is 65 or older, someone from a low income socioeconomic status, or if your mobility is chronically or temporarily mobility limited. All of the transportation needs of these different types of consumers are going to be different, and it's very important to see them through the community members' eyes. So in Module 4, we begin to really look at what transportation services are available in your community, what's available to you right now. And then we expand that a little bit as you start looking further and further out. The goal for mobility management, the curriculum as a whole, is to have mobility managers throughout the state who, if you need to move from your region to the next mobility manager's region, you two could act in concert and move that person where they need to go. We also feel that it's very important that you not try to work in isolation. So community collaboration is a very important part of it. The National Center for Mobility Management has some wonderful modules on how to create meetings with purpose. And we have tapped into those resources for this so that we know you're getting good information on how to, if you've never tried to lead a community organization collaboration project, that you're going to have the resources that the student needs in order to get that work done. In Module 6, we focus on the mobility champion. So what is the knowledge that our student needs to know to be the best mobility manager possible. And we felt that creating that mobility champion, someone who not only can get you where you need to go, but then advocate for your needs in order to continually make transportation more and more accessible and more easily accessible. We focus on this. In this one, we also have content that focuses on how to have difficult conversations. Maybe you're working with volunteer drivers, and perhaps they could use some cultural competency feedback and how to do that, how to have those conversations. And then we start winding it down then with transportation assistance in Module 7. And here is where we focus on how exactly does Missouri Medicaid transportation, how does that work? How is eligibility work? There are a lot of rules and regulations around these state and federal programs that it's going to be very important for the mobility manager to be at least aware of. And so rather than making you a Missouri Medicaid specialist, we make you knowledgeable and show you where to find those resources. And then in Module 8, we do the resources wrap up. We make sure that you have access to all of the possible, to all of the available resources, or at least to give you an idea of what is out there, because there is so much that is being done. Transportation and access to transportation has been recognized as a social determinant of health. The CDC, the World Health Organization, has materials on how access to transportation affects the health of individuals and how it can improve the health of individuals. We have also made evaluation, hearing back from the student, a major part of our curriculum and also a required part. So each module has its own evaluation, and it is required that the student complete it and submit it before they can move to the next module. So I am going to turn it over to Mary Gordon, who will be presenting our last part of this. Mary Gordon is the instructor for this course, and she is also a mobility management mogul, if you will, very passionate about getting people where they want to be. Mary Gordon has over 45 years of management experience. Her diversified work history includes 18 years of business ownership, director of a countrywide volunteer program, which developed 3 senior assistance programs and a senior expo, 15 years working with high-risk youth and dislocated workers, TANF recipients, and management of the Mexico Career Center. Working in a nonprofit organization, had developed networking, collaboration, and communication skills. Thank you, Mary.
Thank you, guys. I'm Mary Gordon, and we're very excited about your interest in this course. So I'm going to kind of wrap it up and I'm going to share my screen, and hopefully we will be able to show you exactly how to get on, and wish this was live where we could answer questions, but we will be here for the future. So want to make sure sharing, Sandy, you can see the screen. I'm hoping you can. Yes. I'm not seeing the screen myself. So anyway, as I said, I'm Mary Gordon, and it's great to meet you. Oh, come on, work here. Work with me. I'm not techie. So we're going to get started on how to enroll in the mobility management course and a little bit about the technical assistance and what we can do to help you support. So here's the course basics. The course is free. We didn't want anyone not to be able to take this course, and we know in this time, especially coming out of the pandemic, funding may not always be a great option. So you've got 180 days from the time you register to complete. This is very self-directed, and you've got to put in it what you want to get out of it. If you want to zoom through it, you're not going to retain very much information. And that's why we wanted to focus this training on not only your community, but the people you serve, so that you really felt like you were ready to hit your community when you got out. And our class size right now is limited. We did that because, well, I'll start with this. Please get your windshield survey completed within your first 20 days, because otherwise we don't see that you're doing anything. We can tell how many hours you've been on there, but as instructors, we're learning as long as you are, and so we're doing that. We can track how many hours you're on there, and we get your courses in. We try to respond back as quickly as we can, but sometimes we have to figure out what we need to respond to or how to do it. But we are learning quickly and picking it up. So as I said, this is a self-directed course, and it is very important to put in what you put into it is what you're going to get out of it. We hope you build your toolkit, which means start with a notebook and start putting that stuff in there, tag it how you need it, put in your links or whatever else you need there. I think you will enjoy having that on hand. Right now, we're limited to 10 students. That's for our learning curve. And so we can kind of work on some glitches if we find them and get them done instead of affecting a whole bunch of you. I can tell you that very quickly we will be opening this up to more students. We can stay in touch with email. We have monthly webinars scheduled that everybody gets invited to. You can come on. We've got them scheduled for an hour and a half. If nobody comes on in the first 15 minutes, we close them down. But we will stay on and answer questions. We know everybody will be at a different level, but we are there. If you want to speak to an instructor right off the bat or have questions, we are there. So I suggest you and hope that you will register and get on the waiting list, and that if you are on the waiting list, it depends on when you got on as to when you'll, the first come, first serve. I guess that's what we will, that's the way it rolls. So to kind of give you a little quick idea how to do this, let's get enrolled. You're going to go to the Missouri Rural Health Association page, and across the top of our website is a brown banner. And the brown banner up there says Mobility Management Certificate Program. And all you have to do is click on that. You don't have to zoom through anything else. You're more than welcome to share and look at the website. The website is in development. We just received a FTA grant that we will be building a mobility management technical assistance center in the next 18 months. So we're taking what we've got and we're just going to really be expanding it. So keep coming back. If you hit that tab, you're going to go right to Canvas, and you're going to hit right on this page. And as you can see, it says add to the wait list right now. What I want you to do is I want you to scroll down and read this course introduction. Before you go in and register, before you do anything else, learn. If you haven't learned from this training and you're sharing it with someone else, tell them, go in and do that, because we want to make sure that this course is something you need. And are the outcomes what you need to learn? Do you already have the materials that you need to be successful in the course? And do you have a learning style that does well with self-directed online reading, watching videos, doing some active interaction activities, but it's you. You're not going to be in with a teacher who's taking you by the hand and leading you through, because that's not what online courses do. You have to be able to not only set your own pace, but you have to be able to be dedicated to come back and follow through on the things you do. And it's not for everybody. If it's not for you, if you look at it and you go, oh man, this isn't what I have, or something happened and you're wrapped up with something and you go, oh gosh, I can't finish this course, then be respectful and withdraw. All you got to do is contact Sandy. Both hers and my emails will be sent, are right there on the front page. If you don't have it, let us know. We'll make sure that you're not in there so that that spot can be filled by somebody else. And then please come back when you're ready to, because that's important. That's why we wanted this online course. We kind of estimate most people will be able to get this done around 6 weeks, but we wanted to give people plenty of time as well. So one of the things I wanted to do is really thank the people who helped develop this. This was not Extension, MU School of Medicine, MRHA. We listened to a lot of voices. The National Center for Mobility Management had a representative at every single meeting we had. They shared, they opened their doors to us. They were great. I cannot say enough about the Missouri Primary Care Association and all of the assistance that they gave us in the community. The focus to help their community health workers, just really exciting. Same with Missouri Hospital Association. You know, access to care is the #1 barrier right now, and so many people are focusing on it because of the pandemic. So, you know, all of those health providers and everyone else gave us so much leads. The Missouri Public Transit and OATS were instrumental in understanding so much of the transit details and helping us link with those types of resources, as well as MoDOT. They were right there with us, leading the way. Missouri Foundation for Health was fantastic with the equity and diversity, and really provided some great input and materials for us to use. Central Missouri Area Agency on Aging helped us identify what seniors and the change in the baby boomer population is doing, as well as the Department of Health and Senior Services, really helping direct us into those people who need have a lot more barriers than the average person. But I wanted to go back and say a special thank you to the regional mobility coordinators. We had 4 areas that had a regional mobility coordinator that came in. They had already kind of done a one-on-one training with Sandy, and we utilized what we trained them with as kind of a base, and they gave us lots of feedback, and they actually kind of jumped on this course to kind of say, oh yeah, that was great. That's, you know, super. So I wanted to say a special thank you for all of them. It really took everyone. It was real easy to get off track, start going down a rabbit hole, and somebody would pull you back. So it was a great time. I just really want to thank everybody. And I really want people to understand that mobility management 8 years ago wasn't even a word that people use. And now it is a giant moving wheel that is expanding. Just today, I looked on LinkedIn, and there was 21,000 jobs in America listed as mobility management. Salary range for mobility people with mobility management skills is $30,000 to $95,000. Just depends on where you're at and where you're going. And the demand for mobility management in the healthcare field is growing leaps and bounds. So I really feel like this is a program that can help expand your career or get you started in a new one. So thank you very much for attending this session. We are here at the Missouri Rural Health Association to help anyone with questions regarding mobility management and some of our other programs. So thank you again. And I look forward to working with some of you guys with the course. So thank you.